In vitro fertilization is a process in which a woman's eggs are stimulated to develop, are retrieved via a minor surgical procedure, combined with husband's sperm, either conventionally or through ICSI, intracytoplasmic sperm injection, cultured for 5 or 6 days, and then the resulting embryos are selected. We select 2 to transfer back to the uterus, again on the 5th or 6th day after the egg retrieval. The woman takes gonadotropins, which are hormone injections, in the days prior to retrieval. The actual number of days of stimulation is about 10 or 11 in order to develop multiple eggs, because in a natural cycle a woman would be ovulating only 1 egg. Egg retrieval is done in our retrieval room. The woman is sedated with what we call conscious sedation. She feels absolutely nothing. The egg retrieval takes about 15 minutes. We use a very thin needle which is attached to a vaginal ultrasound probe, and the eggs are retrieved via through the vaginal walls. The follicles are seen on the ultrasound. They're drained, and the fluid that contains the eggs are then passed to the embryologist. Dr. Smith identifies the eggs from the follicular fluid that we have passed to him in the tubes, in the test tubes. The eggs are then combined with the husband's sperm in one of 2 ways, either conventionally, in which the egg is actually incubated with 50 to 100,000 sperm around each egg, and the egg does the choosing as to which sperm it will select, or via the intracytoplasmic sperm injection technique called ICSI, in which an individual sperm is picked up and injected into the eggs. The embryos thus developed are cultured for 5 or 6 days. We wait until the blastocyst stage of development to select 2 embryos to then transfer back to the woman's uterus. This is done in a similar position. The woman is on the table, speculum in the vagina, and a very thin catheter that was placed through the cervix. The 2 embryos are placed into the center of the uterus. The woman rests on the table for a short while and then goes home. Over the ensuing 2 weeks, she takes progesterone in the form of injections and vaginal cream to sustain the uterine lining or endometrium, hoping that an implantation will be there that will need to be sustained. When we do in vitro fertilization with blastocyst culture and transfer, each expanded blastocyst that we transfer has a 25% chance of implanting and going the distance, bringing home a baby. This is not pregnancy rate, this is take-home baby rate. IVF is more efficient than intrauterine insemination, although we really don't know why. But it is an option for people who have had 2 or more failed intrauterine insemination cycles, or if a woman has absent or blocked fallopian tubes, or if there is a severe male factor, or just a history of previous fertility problem.